Welcome to Imperfect Heart, a place for you to join me, Jeff Holden, in conversations, discussions, and dialogue about our hearts and the impact myocardial bridges have on them. We'll talk with healthcare professionals, those in related fields that support our condition, and others just like us with stories of their myocardial bridge experiences. It's my intention for this content to inform, educate, entertain, and even motivate or inspire you in your personal journey on dealing with a myocardial bridge. Most importantly is to have you leave each episode with hope, knowing you're not alone and that what you're experiencing is real. My guest this episode is not your typical 60-something. Not only is she an active and engaged individual, but she hails from a family of 6 siblings, has 2 children, and is a private pilot as well. She's also a self-proclaimed terrible patient, as you'll hear from her explanation of following doctor's orders in the conversation. Where there is familiarity is in the story we've all heard so many times before. The misdiagnosis, the frustration, the concern, the fear, even the depression that can settle in on the most positive amongst us. She also holds the distinction of being one of the first American patients to visit Dr. Kofidis at his new home hospital, Hygeia Hospital in Greece. More on that later. This is one incredible woman with a spirit of optimism and positivity that most certainly got her through some of those darkest moments on the way to a resolution for her heart concerns. I'm really anxious for you all to hear her story, so let's just get on with it. Mary McDonald, welcome to Imperfect Heart.
Thank you. Thank you, Jeff. I'm happy to be here.
You know, as with all our patient guests, yours is a bit of a unique situation. And, what led you to the realization that something was wrong? When did you first recognize this isn't normal?
Well, I'm going to back up a little bit. I have a family history of heart disease. Both my parents had heart disease. I'm the youngest of 7 siblings, and all but one of my siblings have heart problems to some degree. I think 3 of them have high blood pressure, high cholesterol, and then 3 of them have had surgeries. My sister's had 2 heart attacks. So it's in the family. So I knew that I had a problem back in my 30s when I had uncontrollable high blood pressure and uncontrollable high cholesterol. Now, mind you, every single one of my siblings has the same frame I have. We're all small, in shape, work out, a lot of runners in my family. So there's no reason for us to have heart disease except genetics. So I had that. I got the genetics of my mom and dad, and I was put on high blood pressure medication when I was in my 30s, and I didn't take my high blood pressure medication. Never took it for many years, 20 years. I didn't take it. I thought, there's no way. I don't drink. I don't smoke. I run every day. I work out. I eat healthy, except my McDonald's ice cream cone that I've been eating for 30 years. But I don't need medication. So I didn't do it because I didn't have any symptoms. So why would I take it? And it wasn't explained to me the importance of taking high blood pressure medication if you have severe high blood pressure. And when I say high blood pressure, my blood pressure would run from about 140 or up to 180 over 80. And that was standard. I don't ever remember going to the doctor's office from the time I was in my late 30s and having a normal read. And so I should have been taking my medication. So if you have high blood pressure out there, take your medication. So then what happened was about 8 years ago, I had a major foot surgery. Even though it was major, it was outpatient, and they couldn't get my blood pressure under control. They did everything. They gave me IV medication, and it just wasn't stabilizing. They couldn't take me off the medication and maintain a proper blood pressure. So they kept me overnight. They did some tests. I don't really know what they did. I wasn't really paying attention. I just wanted to go home and start the healing process so I could run again. And the surgeon came in, and it was an HMO. And the surgeon came in and he said, I've contacted your primary care doctor, and you had better take this high blood pressure seriously or you are going to have a heart attack and or a stroke. So you need to be on your blood pressure medication. So for 8 years, I've been loyal with my lisinopril and taking it, but it didn't do anything. It didn't really help. My blood pressure really didn't go down. I still had the same high blood pressure problem. And so then that
And if I'm,
continued. And it,
I say,
oh, go ahead. Sorry.
if I'm not mistaken, you even said that you would travel to altitude, which could even exacerbate some of the, the blood pressure situation and maybe some discomfort with regard to
Well,
just altitude changes, right?
not at that point.
Oh,
At that
okay.
point, altitude wasn't affecting anything. Nothing was affecting me. I just had high blood pressure and high cholesterol and no real reason. So
Hmm.
it wasn't until 5 years ago. 5 years ago was the turning point for me. And that was when I became symptomatic. I live at altitude of 5,200 in Lake Arrowhead. So at that time, I was living full time at altitude of 5,200. So my body was acclimated. And what happened was I was going up the stairs. We had 43 stairs from our front door to our garage. I have 4 dogs, of which I took to the dog park every single day. So I'd go up the stairs diligently every day, faithfully, no problem. All of a sudden, I go up the stairs with the dogs and I'm carrying something. So the first few times it happened, I was holding something. So it was with carrying weight. And midway up the stairs, there's a landing. And I dropped what I was holding and I just put my hand to my chest and I just couldn't breathe. I just had a shortness of breath that was so severe that I was really scared. Well, this went on and became more frequent. First, it was every 2-3 weeks, then it was every week, then, and this is over the course of a couple of years, it became every single day. Didn't have to carry anything, didn't have to go up the full flight of stairs for it to happen, and it just became, more of a problem. So, knowing that I had this heart disease in my family, I was sure it was something related to that. So, I asked my doctor for a referral, and I was referred to a cardiologist who put me on like 3 different medications, changed my blood pressure medication, put me on a statin. I had side effects, and without telling him, I discontinued my statin. And I'm just not a really good patient, to be honest, when it comes to medications. I just was young and not very wise. And so I continued to go to the cardiologist, and my blood pressure still stayed elevated, but he kept saying there's just no reason for this. They would do an EKG every time I'd go in, and there's no reason. You're very, very healthy. They did blood work, they did all the simple tests that you can do. And I don't know if they didn't take me seriously or I just appeared like I shouldn't have a problem. So it just went on, and I just lived with it and thought I was going to have to live with it. So what happened that really turned, you know, everything kind of upside down was I started to have some really severe pain and discomfort and angina that was, I thought I was having a heart attack after I had gone to a family reunion in Colorado. We did a tremendous amount of hiking, and that was when I was at a much higher elevation. We got up to about 8,000 at that time, and I just couldn't do the hikes. I just couldn't do them. I was in pain every day. I felt so bad. This was a week-long trip. Every day was a big hike. My husband's family is big and as active as my family. And it was something we looked forward to for so long. So I told my husband, just, go ahead. I'm fine. I'll just do my running down here at, Mile High
Uh-huh.
and I'll walk. And that was fine. I didn't have problems when I ran initially. So I came home, and for about 4, 5, 6 days, I couldn't walk across the floor. And at that time, we came home to our Laguna Beach property. So we're at sea level. We're not even at 5,200. I couldn't walk across without pain. I was so incredibly short of breath. It was scary. And my husband kept saying, I'm going to take you to the hospital. I'm going to take you to the hospital. I'm going to call 911. I said, no. I'm not going to the hospital. I just knew I was fine. And so eventually I went to the hospital, and they did a blood test, which showed this is after like 6 days, I had a slightly elevated, say the word troponin,
Troponin, correct.
yes, level. And so they couldn't really identify if I had or had not had a heart attack. But they knew that they did a lot of tests and said my heart was not damaged. They did a echocardiogram, and they said, you have, everything's good except, and this is the hospitalist that told me this. He's not a cardiologist. He said, you have a myocardial bridge. Have you ever heard of that? Oh, let me back up. At this point, I had already discovered Barry Mers at Cedars. Because my condition had gone so bad, in my opinion, I decided to seek out a specialist. So I sought out Dr. Barry Mers at Cedars-Sinai. She's the head of the Barbara Streisand cardiology group for women. And she's very well known. Her CV is unbelievable, and I knew she would take care of me. She did an angiogram, thinking she was going to there was going to be a blockage and she was going to send me right into surgery, or they were going to do it right there. And it wasn't. And I came out and she said, I have good news and bad news. The good news is you don't have a blockage. The bad news is you have a myocardial bridge. And I said, well, what is that? And she said, well, and she explained it to me. And then she said, the way that it's treated is with medication for the first 6 to 12 months. So we're going to start you on a very aggressive treatment. We're going to try new meds. If it doesn't work, we're going to try different meds, and we're going to go through the process. And so
I'm actually smiling here because we know how much you like taking meds to treat your symptoms.
Yes, absolutely. Absolutely. Well, also during these tests, I was told, during the test when I went into the ER, during the test when I would go to my cardiologist, I hopped around from a few cardiologists because I also, like a lot of the people on the podcast and people on the Facebook group, I also had a cardiologist that said that I needed a referral to psychiatry. And my husband was with me at that time. He didn't go to all the appointments with me, and he just couldn't believe it. He was just flabbergasted. So was I. And I was hurt, and I left, and I cried because it was real, and I knew it was real. So during all the different angiogram, echocardiograms, different tests they ran, blood tests, all those things, it was determined that I had 2 valves that had moderate regurgitation. So from that point forward, it didn't matter that the hospitalist told me I had a myocardial bridge. It didn't matter that Dr. Barry Mers, one of the best cardiologists in the world, told me I had a myocardial bridge. I was a cardiologist in my head, and I knew it was from the moderate heart valve regurgitation. Little did I know that I should have listened to them, because my pain had nothing to do with that, because a moderate heart valve regurgitation is really nothing. And it does not cause symptoms. There's enough literature out there to prove that. But I didn't know what a myocardial bridge was. And they said, this is very common. This can be treated with medication. You'll be fine. So I thought, no, what I'm feeling isn't fine. So it's got to be more serious than a myocardial bridge. So that's why I was convinced it was a heart valve. So that happened.
And timing-wise, we're looking at probably summer of last year?
It was a year and 2 months ago that I went to Colorado. Yes. And so I'm on all these new medications. I'm trying new ones. At this point, I've matured. I'm in my late 50s at that point, and thought I better take these medications. I need to, if it's possible that these 8 medications will relieve my symptoms, by all means, I'll take anything. I just wanted them to go away. Also, I started looking up myocardial bridge, and I didn't like what it said. So I shut the computer and stopped researching myocardial bridge, to be honest. I didn't want to read any more about what it was, because I was never going to have open heart surgery in my head. So I'm going to try every medication. I followed. Dr. Barry Mers was amazing. She was very attentive. Her staff was amazing. All the nurses, everybody. I have no complaints. However, I was put on for 6 months a 0.4 patch
Nitroglycerin.
Nitroglycerin patch,
Yep.
yes. And I was to wear that every day when I worked out, and I could wear it up to 8 hours and no more than 12 hours, or I'd get a headache, which sometimes I forgot and got the headache. And it didn't help, but I continued it because I thought it's got to help. I mean, maybe it's helping, and I just didn't realize it's, not helping. You start playing these games with yourself because you're so desperate to feel better. And so I continued this roller coaster of going back to Cedars-Sinai every 2 months for new medications and new reports and really no additional tests, knowing that she was waiting this out. They don't do the surgery there at Cedars, and she was going to have to refer me, and I knew that. So then I thought, okay, it's probably time I do my research. And I started the research, and that's when I found you. And I started listening to every podcast. I just was looking so forward to my daily run, and I'd put on the podcast, and if there was one I really liked, which there were all of them I liked, but maybe they pertained to me, then I'd listen to them again on the next day's run. And it was really disappointing when I got through all the podcasts, and I'd be like looking and waiting for the next one to drop. But so this was going on, and I thought, okay, I need to really research this myocardial bridge. So I really looked into it. I hadn't joined the Facebook group yet. Believe it or not, I've never joined Facebook. I've never been on Facebook. So the Facebook group was my first, when I did finally join, that was my introduction to Facebook at 61. So, so I just kept doing the meds. I kept doing my research. I really kind of honed in on, if I have to do anything, it's going to be at Stanford. I was convinced Stanford was where it was going to be because there weren't any options to my knowledge in Southern California. So I had it in my mind, I was going to go to Stanford. I just needed to do a little bit more research. Then I started listening to the podcasts over, and I listened to Dr. Boyd's podcast again and again. I listened to the radiologists from Stanford podcasts again and again. Thought, okay, maybe should I do robotic? So I listened to Dr. Balke and Dr. Guy, and I was really getting all my information that I needed to make the right decision. And then January 31st, I was in a pretty bad head-on collision, and I had to go to an orthopedic surgeon. And when I was at the orthopedic surgeon's office, he walked in with a student, because I think every medical office in Southern California is a teaching facility or teaching institution. And he said, when he first looked at me, and he put the x-ray, they had already done the x-rays before he walked in. And he put the x-ray up, and he looked at me, and he said, well, your wrists aren't broken, but has anyone ever told you, or have you ever been looked at for Marfan syndrome? I knew exactly what Marfan syndrome was because my son went through all kinds of evaluations at 6'8", and he has a lot of the characteristics. And I said, no, are you serious? I'm only 5'6" tall. And he said, no. He said, do you have, and he asked me these certain questions, and he said, do you have any heart problems? And I said, well, I believe I have heart valve issues, but I'm not sure. And he said, okay. And he said, because your hand x-ray is an indicator of Marfan syndrome, I think you should be referred over to a specialist. So he referred me over to Dr. Liang at Hoag, which is right down the street from where I live. So that was perfect. So I went home and I researched Dr. Liang, and guess what? He's also a doctor at Stanford, and he's a cardiologist. So
What are
I
the
thought,
odds? What are the odds?
it was kismet. It was amazing. So I'm like, hallelujah. I know I don't have Marfan syndrome, but since I was referred, I might as well call and get in there and say, I'm here to be evaluated for Marfan syndrome. Then as soon as I'm right in front of him, I can talk to him about getting a referral to Stanford. So as soon as I went in, so I made an appointment. They were really excited because they want to treat people with Marfan syndrome. So I went in. The first thing I did before I met Dr. Liang is they did a echo, and he came into the office and he looked at me and he said, why did you think you had Marfan syndrome? And I said, because of a hand x-ray. And he said, okay, you don't have Marfan syndrome. And I said, I know, but I wanted to come in anyway because you are a cardiologist and you work at Stanford. And he goes, okay, wait a minute. So I've got good news and bad news. you don't have Marfan, but you do have myocardial bridge. Is that why you're in here? And I said, well, I did want to find out about the Marfan, but yes. And he said, okay. And then I sat and talked to him for 45 minutes, told him all about what had been going on, all the treatment, all the medications. He already had everything. It's kind of amazing how these institutions can, with a click of a mouse, they can get all my records from Cedars-Sinai and from Hoag and from Mission Hospital, where I went to the emergency room. And so he had everything. So he knew I had been seen by Dr. Barry Merz, and he knew Dr. Barry Merz, not personally, but he knew of her. I guess every cardiologist knows of her.
Well, and
And
another side to that story too, because so many of the doctors now we know they've got access to that information, but how
yes,
many actually take the time to look at it? And in
exactly.
his case, compliments to him because he actually looked at your entire history.
Oh my gosh. Well, he did, because it took him about 30, 40 minutes to come in. And I know he was reviewing my charts. I know he was, and looking at my images. He was amazing. And his bedside manner, contrary to what anybody ever says about a doctor. Actually, I think most all the cardiologists I have encountered, except one, had amazing bedside manners, like a pediatrician. I mean, they were so sweet. And he's just as. So, I said, oh my gosh, I'm thrilled if you could give me a referral. And he said, yeah, it's the best for myocardial bridge. And he said, your myocardial bridge is very unique. And I said, why is that? I hadn't heard this before. And he said, it's tortuous. And I said, well, I know what tortuous is, so kind of explain. And he said, like, we can't see it that clearly, but it goes deep into your heart, and it appears to have some twists in it. I said, oh, okay. And he said, that could cause a more severe symptoms. And the fact that you've been on the medical route for a year, you're essentially a candidate, but you need to determine if that's what you want. It's open heart surgery. And I said, okay, let me go home and let me talk to my husband. He wasn't with me. Let me talk to my husband. And he said, why don't you come back in 2 weeks and we'll discuss it further, and then we'll get the ball rolling. And at that time, Stanford was still doing the procedures. So I think they've put them on hold now. So I went home, talked to my husband. We did our research. He listened to probably 6 of your podcasts because I needed to educate him a little bit more. And then he encouraged me to join the Facebook group, which I did. And there's so much information on that Facebook group.
Right.
So I spent that 2 weeks. I'm retired. So I spent those 2 weeks doing my homework and researching. And the more I listened to Dr. Boyd's podcast and all the other podcasts, I thought, if I'm gonna pick a surgeon to do this, out of all the surgeons you've had on your podcast, and then doing homework on surgeons that aren't on your podcast, I really, really liked Dr. Kofidis. So I had it in my head that I wanted to find out more about Dr. Kofidis, and he makes himself so available for consults that it was something I couldn't pass up. So 2 weeks later, I walk into Dr. Lang's office, and knowing that most patients have a really difficult time getting into Stanford, that was in the back of my mind, and I didn't want to wait a year. And also knowing that Dr. Kofidis has more availability, and I really, really liked what he had to say, and I love his background and his CV. He is a very, very accomplished cardiologist. So
Yes,
I brought his name. Pardon me?
yeah, I said yes, he very, very much so
Yeah.
is.
Yes. So I brought his name up to Dr. Lang, my cardiologist, and he goes, I know Dr. Kofidis. I go, you do not. Come on. And he goes, no, I know him. I referred a patient to him. I said, what do you mean? Are you kidding? He said, no. He said, I had a European patient with Marfan syndrome with heart valve, needed their 2 heart valves replaced, and they could not get it for under $1 million here in the United States. So I referred him to Dr. Kofidis, and I think they met at an international cardiology meeting. Oh, no, they met. What am I thinking? They met because Dr. Kofidis did did some training at Stanford for a period of time.
Right.
So I think it was the combination of those. That's where they originally met, and then they stayed in contact. And he has actually referred two patients to Dr. Kofidis. So when I told him Dr. Kofidis, and I listened to his podcast and I did a lot of research on him, he said, you know what, this is your decision. This is, you have the ability to go with who you're comfortable with. And I'm more than happy to, continue pushing for you to get up to Stanford. But I understand there's a wait, but you have my support. So we discussed how it would work if I went overseas or went to Greece for this. We discussed it a little bit, and I said I'm going to set up an appointment with him, and when I make my decision, I'll let you know. And he assured me that I had his full support. And so that's what I did. I emailed Dr. Kofidis and I set up the appointment, and we took it from there.
How did you find the Greece experience from hospitalization to recovery? Because you have to stay 2 weeks, if I'm not mistaken, and just the entire process by comparison to what you know at the United States.
Well, first of all, let me back up a bit. After my first consultation with Dr. Kofidis, and it was with my husband too, and we then Mark and I, my husband and I, talked, and we both said this is the person we want to go with. It was about 3 or 4 days before we called Dr. Kofidis and said we're going to come to Greece, and I was set for surgery 3 weeks later. And during that time, the contact, the availability that Dr. Kofidis provided me is something I've never experienced. So there is a hospitality that the Greeks have that I'm not very familiar with here. It's a little bit faster pace here, kind of get in, get out. Not with the cardiologist. Like I said, I had great cardiologists, but he was so personable and so available. I would send him an email, and even though it's a 12-hour difference, he would always respond. So attentive from day one. So he immediately, after the decision was made, probably I'd say, a few days later, I got my initial letter from Gregory. Gregory is the international patient coordinator with Dr. Kofidis at the hospital I went to, which is Hygia, Hygia hospital in Greece. And it was thorough, step by step, what was going to happen, what I needed to do, and what to expect when I arrived. Along with that were a list of 3 hotels that I could book for my husband, because my husband was going to go, which were right next to the hospital. And maybe after a week when I was discharged, I could go down to where the historic area of Greece is. So just accommodating beyond words. When you're going through something like this, not only are you nervous because you're going to be having surgery, but you're still in pain, and you have so many questions, but it just seemed like the questions were answered before they were questions. And it was an incredible experience. I fly over to Greece, and just like they said, there was someone waiting there at the airport with my name on a card and lifting it up, and drove me straight to the hospital, drove Mark and I straight to the hospital. And that is where I met some of the staff that was going to be doing the procedure. Procedure wasn't going to be for 2 more days. So they were going to do all the pre-op, but not that day. That was a rest day. That was a sightseeing day. But they wanted to meet me immediately. So they met me. They gave me a tour around. And I saw Dr. Kofidis and Dr. Patakos, who is his right hand, who did 15 years of training here in the United States at 3 different amazing institutions. And so he was going to be his right hand. And I met all of them. And then the next day at 3 p.m, I was admitted. And that was when they give you all the iodine, and they're doing all the prep the night before, the shaving and everything, and just getting you comfortable in your private suite, which was incredible. So going back to how does this compare to the United States? Well, I've never had a room that looked like a hotel room. And yes, I could tell it was a hospital room, but it was very it was just very private, very nice, very hotel-like.
Mhm.
And majority of the staff spoke English good enough to communicate with me, and they were just amazing. I put my Netflix into the TV and I started watching my movies, and I was, getting excited for the next, the
And
next chapter in my life.
how would you evaluate the recovery? Because obviously the surgery, none of us are aware to any great degree. But when you came out of surgery, how was the next couple of days, the process, the ICU, and then the dismissal? And if I'm not mistaken, you were a sternotomy patient. You didn't have minimally
Yes.
invasive.
Yeah, let me address that part first, the sternotomy. Um, Backing up in my conversations with Dr. Kofidis, um, he we talked a lot, and he had all my images, and this is before I left to go there. And I said, Dr. Kofidis, you're great. From my understanding, you're a very good robotic surgery surgeon. Is that an option for me? He said, in your case, unfortunately, it's not an option. And it was because of the tortuous um, LAD and myocardial bridge. And he said, but the reality is, I'll never promise a patient that I'm going to definitively do robotic surgery. It may appear that that's what we're going to do, and we will start doing that. But if there's any question once I go in robotically, we back out and we will do a sternotomy, whether it's a minimally invasive one or a full sternotomy, which is what I had. So I was prepared for the full sternotomy. And I had sent Dr. Kofidis my DEXA scans that I'd had, one 6 months earlier, one 3 years earlier, all of which said I had typical osteopenia, which is normal for somebody my age. And
And for the benefit
so,
of those who don't
mhm,
know, that's a bone density situation. As women age, it tends to
yes,
become a little bit more
abs-
brittle.
absolutely. And especially I'm very slim and a runner, and it's just a little bit more common. So that was not a problem, he said, for doing the full sternotomy. And I came out of surgery. So now we're back to surgery. So then when I came out of surgery, I had, I can't believe I can't remember her name. I want to say it's Gina. I had the best, and I bet everyone says this because you're like, you fall in love with your ICU nurse because they're so compassionate. She was amazing, amazing. I mean, I just wanted to, when I left 2 weeks later, I wanted to just yell in the hospital how great she was, because she made that opening up my eyes experience just so much better. She was there for me. She was just whatever I needed. She was like, it was like having my sister there. It's like, just imagine, who would you want in surgery? If you can't have your mom, who would you want? I'd want my sister. And I felt like I had my sister there. She was treating me just like family. And it was an incredible experience. I've come out of quite a few surgeries. I've never felt that before. And she's just so good at her job. So then they did the brutal transfer up to the room. Oh, that's so painful. And I was on pain meds, and you just pain meds can just do so much. I mean,
Yeah.
it's a painful time. And I also had some complications in surgery that we didn't anticipate. So once Dr. Kofidis went in, Dr. Kofidis and his staff of 6 went in, they discovered, very unfortunately, that I had full blown osteoporosis, and my sternum and ribs were like Swiss cheese, very frail, very brittle, dangerously brittle, they said. And it concerned them a lot. So they put, because of my small frame, they put extra wires, really small wires, to just keep it, really tight. And boy, did I get an education on the pillow, the pillow. So
And
not
by
only
the
that, I
pillow,
also,
we're talking about the heart pillow that you hold
yeah,
against your chest to breathe,
yes,
up
they
to laugh or
they did
cry.
not have the infamous heart pillow, but they had a pillow nonetheless, and I loved
Okay.
it. And I also had developed a mild to moderate pneumothorax. And so they put of course, they have the chest tubes in. Pneumothorax is um, it's the air. that is in the lungs, between the lungs and the chest cavity, I believe, but it's excess air, and they need to keep a very close eye on that. And so they did. And because of that, I had to keep my chest tubes in for an extra day. So I had them in for 3.5 days, which is longer than I wanted. So then I went up to, so after surgery, after the beautiful ICU nurse experience, they wheeled me up to my private room, and I just thought I was going to die from back pain. I didn't feel the chest pain as much as I felt the back pain at that point. And I was just begging for more pain meds. And that first day, they give you pretty much whatever you want to make you comfortable. But then I had numerous doctors, the cardiologist on the floor. I had Dr. Patakos, I had Dr. Kofidis all come in, and they just said, I know you're under heavy, sedation still, but we have to tell you a few things. You can't move. You can't use your arms to lift. You can't use your arms to hold the side rails. You can't do anything, because they were really concerned about my frail sternum. And I was reminded of that. It seemed like every hour on the hour, because they were watching me so closely. And so I just had nurses in there all the time. What do you need? Do you need water? Do you need giving me water through a cup? Just doing anything and everything, because the surgeons told them she can't move. You got to be very careful. And they were concerned about me being on heavy sedation or heavy, pain meds and not feeling enough. And so here I'm progressing. I'm doing better. I'm kind of getting the swing of it. And yes, it's painful, but I expected the pain. And then we go into day 2. I'm still in a lot of pain. I'm begging for the highest dose of pain meds that they could possibly give me, which I believe was morphine. That's the highest they give you, but they don't put you on a drip. So in Greece, you're not on a drip. You're not on a pump. No, I don't know if it's a drip or a pump. No, they put it IV, but you can't pump it in like
Got it.
surgery here in the United States. And they have to give it to you, and you have to need it, and you have to request it. So I didn't like that. That's different from what I was used to. I never needed a pump in a previous surgery, but my husband did for hip replacement. So I knew what it was. So I said, I need more meds. I'm in so much pain. So Dr. Patakos came. Now at this point, it had been 2 full days. He came in and he sat on the bed and he said, okay, you're awake enough now. We're going to create your pain management plan together. And this is how we do it in Greece. I said, really? I said, it's not the same protocol for everybody? He said, not in Greece. I said, okay, explain. And I like everything explained. I will adhere. I'll comply. I'll be the best student if I understand. So he said, when you have this open heart surgery, you're at a high risk of pneumonia. You're at high risk of damaging the hard work that we did by the sternotomy. You're at high risk of not feeling the pain if we put you on high pain meds. So we want you to feel the pain, but we want you to have comfort to a degree. But you need to feel it. You need to know, so that you don't do something that's going to affect or hurt or harm what we've done. You also need to feel it so that you will continue to recover. Recovery is coughing. You need to cough. When you've got that phlegm in your chest, you need to cough, and you need to keep the airways open and keep your lungs working, especially because I had a mild pneumothorax. And he said, so let's come up with our plan. Here are the 3 different types of medication. There's 1, there's 2, there's 3. 1 is a rotation of Tylenol and ibuprofen. Number 2 is basically Tylenol with codeine. And number 3 is morphine. So we will put you on a regimen of the Tylenol and ibuprofen after day 2, unless you need more. I said, okay. I can't imagine not having more, but okay. And he said, "Do you understand why you need to do this?" And I said, "Yeah, I do." And he said, we really want you to recover well. And that's why we keep you here for 7 days, because we monitor your pain management. And if you need it, by all means, we are not going to hold back. We will never hold back. But everybody has a different threshold for pain. And to have a standard protocol for everybody isn't serving them well. And I just appreciated that so much. And so as he was leaving, I said, "Can I have number two now?" And so it was kind of funny. And then but I took to heart what he said. And by the middle of day 3, I was off everything. I was only on Tylenol and ibuprofen. And he gave me, I think it must have been it was the end of day 3 when they took the tubes out. And he said, sometimes when we're taking take these tubes out, it can hurt. Would you like the number 2? I said, "Oh, I've been doing so good on number 1, but okay, I'll take the number 2."
Mhm.
And he did that. And then, 10 minutes later, the tubes came out, and I said, I don't think that would have hurt that much. I think they think it's a big deal. The tubes coming out, I don't think it hurt at all. And it wasn't because I was on pain meds. So that's something I would tell people that are having the surgery. Don't sweat getting anything taken out. It's wonderful getting it taken out. It's freedom. So
Yeah.
anyway,
Yeah.
so
There are
go
a
ahead.
couple of points there that I want to readdress for everybody because I try to make the emphasis. You were talking about the lungs and the significance of breathing properly, but the other significant part is using that spirometer. You've got to really use the spirometer, and some people want to do it for a day and it's too hard and I don't want to bother. Well,
Oh
if you
no,
don't, your lung capacity could change. You could develop a
absolutely.
pneumonia, and it's
Yeah. Yeah.
significantly important, as difficult as it is and pain in the butt that it is, you must do it.
Oh
And
yes. Well, that's funny you say that. So that not a problem here. I'm competitive. I was competing against myself. I I always had that in my hand. I was playing with it. I was determined because it's really weird. The first, you know, day when you have that and you can't do anything. The balls don't even move. It's like nothing. They don't move at all. And you just can't imagine having those balls go all the way to the top. And I was just thinking, no, 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 no. When that therapist comes in tomorrow, I'm going to show him something. So he had come in and I couldn't do it. And I said, "When you come back tomorrow, you're going to see." He's like, "All right, all right." And I said, "And if I can get one of those balls up, can you sneak down to the cafeteria and get me a Diet Coke? Because they won't let me have it here." And he said, "I'll see what I can do. But yeah, I've got to get a ball up there. So that means you got to practice." So this is like day 3 and 4, probably day 3. I got 1.5 balls up by the beginning of day 4. All of them were up every single time. And I'm like, "You know what? You need to go on to another patient because you're wasting your time here." And he'd bring me a Diet Coke every time he came in. And so I said, "Did you get permission?" He goes, "I kind of had to." So he talked to Dr. Kofidis. And then my husband snuck in French fries. And Dr. Kofidis would come in and he says, "This is a regular old McDonald's in here, isn't it?" So
were the
anyway,
french fries from McDonald's?
no, they're from the cafe downstairs.
Oh, okay, okay.
I
Were they as good in Greece as they are in the United States?
They're very good. They're very good. The food at this cafeteria downstairs, oh my gosh, you wouldn't believe it. It was gourmet Greek food. It's not like hospital food. It was the best. But I'm diabetic. So they had me on a diabetic diet. So I had to cheat. I had to get some allies to get me food from the cafeteria. I can't survive on that diabetic food. Oh my goodness. So I missed my McDonald's ice cream, I have to say. I didn't get that, but I got they allowed me. Dr. Patakos allowed me to sneak in. I got a burger and I got some things,
Good
but
for you.
but you know,
Yeah, one thing we didn't say is the actual date of your surgery, and I think it's interesting that we've gone this far in without addressing when it was because people are probably listening to you and going, "Wow, she probably had her surgery maybe a year and a half ago." Your surgery, literally the day that we're recording this is July 12th, was April 12th. So you are just
yes,
now out of
3 months
literally out of
today.
sternal precaution.
3 months today. Yes. It
Congratulations.
doesn't, I can't even believe it because I have felt like I can do everything for the past month. Wasn't, I haven't because I was told not to. I didn't lift. I'm lifting pretty normal now. Um, I'm lifting very normal now,
Mhm,
but I started running at 6 weeks post op. And well, I shouldn't say run. I'm not really a runner anymore. I'm a jogger. I'm a
mhm.
light jogger. 12-minute miles is that's my standard. And I can run now 2 miles without stopping and maybe a total of 3 or 4 miles in one outing, where I'm walking and then I'm running and walking. So, but it, recovery for me um, was another, I don't know, competition against myself. And it's really hard for me to sit down and be still anyway. So the only thing that's going to get me down is if I'm literally sick or I have some ailment. It's not going to be the doctor telling me you have to rest.
Right.
I don't rest very well. As a matter of fact, I begged for them to let me discharge me early, so they discharged me a day early. And on that day, I went down to the famous Greek Olympic Stadium. Oh my gosh, where the gargoyles are, and oh, it was amazing. And I walked 4 miles on day 5.
Well,
So
and
it
you're
was,
you're in a city known for its Mediterranean diet,
yes,
which is the
yes,
healthiest diet of all, so you're in good shape there.
yes,
And
yes,
I think as people are listening to just your positivity and your upbeat nature, I think that has so much to do with it. And the fact that you're just going to get through this. It's part of the process, and
hmm,
you will do what you need to do. And for those people who aren't in this position, who maybe are really scared about that next step or really afraid of the sternotomy or the surgery in general, it's really about an attitude. And
yes,
you can hear it from the first time we spoke. I said, "This is why she's doing so well so early on, because you were going to, period."
yes. Oh yeah. Well, the limitations that I had been progressing over the past 5 years were so limiting. And I had another incident. If I could back up, I had another incident that was so scary that happened more than once, but the one incident was really scary, and that was kind of around the same time that I had really realized with going up the stairs that I had a real problem. And it wasn't until, this past 6 months or the past year that I realized what happened. And I'm a pilot. I became a pilot about, I don't know, it was like 7 years ago, and not something I ever thought I would want to do, but my husband and I fly for Pilots and Paws, and we're animal fanatics. So we spend our weekends transporting animals that need help. And so that was just my motivation for getting my license so that we could both do separate trips and help more animals. And so on this one particular occasion, I was coming back from a animal transport, and it wasn't that far. It was a few hours away. And I realized when I got up in the air that my radios weren't working. They weren't working properly. They're going in and out, in and out. And when I was talking to air traffic control, they would say gargled and unreadable, and they'd say my tail number and say, say again. And I was getting really frustrated. So I was spending a tremendous amount of time trying to fix my radios while I was flying home. So it was fine because I wasn't in crowded airspace. So I knew I was relatively safe. But nobody could see me in the air. I couldn't see them. I couldn't hear them, and they couldn't hear me. And you've got to be able to communicate with other planes and with air traffic control and approach. And so, very scary. I get into my airspace, I get closer to my airport. Now I'm starting to panic because I'm in extremely crowded airspace. And it had been building. My heart had been pounding harder and harder as I was getting closer and closer to my home airport. And now I'm wanting to go into what's called pattern. Pattern is like a road, an oval road 2,000 feet above a runway. So imagine an oval shape, and that's where planes go in and out to when they're doing pattern work, kind of like an airplane roundabout. They go in there and they come out of there. So I'm not allowed to go into that airplane roundabout unless I have the tower's permission. Well, I couldn't communicate with the tower. So I am starting to panic. And then all of a sudden, this angel in the sky heard me. And it was another airplane. I didn't know where he was or who he was. And he said, I hear you. I'm going to communicate with your tower for you that you're coming in, 985 Quebec. And I'm like, holy moly, thank you. But I said thank you to him, but I couldn't communicate with anybody else. And then he took off, but he was going somewhere else. So I knew the tower knew I was coming in. And all of a sudden, my plane took a hit. It was from a heavy Amazon took off. My airport is an Amazon hub, 20 flights a day. That huge airplane took off, and the wake turbulence off their wing, which is my plane was below diagonal. So when that tornado of air comes down and it hits a small plane, it's the number one cause of small aircraft accidents is wake turbulence. It hit me so hard, and I grabbed onto the yoke, and I didn't think I was going to survive it. And I was panicking. And all of a sudden, my heart is racing, my legs are shaking, and the pain in my chest was so debilitating that my vision started to get blurry. And I knew I was going to, I really felt like I was going to crash. I just didn't think I was going to recover. And I was just, then the wake turbulence was gone, and I was holding the yoke with one hand and putting my other hand over my heart, just like, please just get through this. And what is this pain? Thankfully, I landed safe, taxied over to my runway, to my hangar. My husband was there. I got out, hysterical, screaming, crying, and said, until I get new radios in my plane, I'm not getting back up. So that was probably the worst experience of all. So that was another motivation for having this surgery and realizing I can't live this way.
Yeah, and at
And
that point in time, you didn't realize that
no
your
idea.
heart was it was a myocardial bridge causing all the symptoms.
No idea. None
Yeah.
whatsoever. I explained that to my cardiologist. A year later, I said what happened and said I felt like I had a heart attack. I never went to the hospital, but I really was feeling like I was having a heart attack. Could have been a panic attack, whatever it was. My myocardial bridge absolutely exacerbated those symptoms. That was not just stress or panic. That was symptomatic.
And
So I had to
today
do something.
today now you're a year out. You've or 3 months out from surgery, but, a year from
Back.
significant symptoms. How would you say you feel as you're getting back into normal day-to-day life?
Well, surprisingly, I can say from the first or second day after surgery, I noticed that I was better. That's how frequent my symptoms were. My symptoms were when I was sitting still watching TV. I would have severe angina. I would get up to go get a glass of lemonade at night when we're relaxed watching TV, and I would have a severe angina and shortness of breath. It was so common that it made it very obvious right after surgery that I was better. And I noticed it immediately. And I have never, ever once in 3 months had an episode of angina. Yes, I've had the shortness of breath. That's normal. It's going to take time for my lungs to heal perfectly, especially because I did develop the flu after I came home. And that kind of gave me a little setback, but not long. Um, but I just feel, okay, let me tell you this too. This is the other thing that's really weird. I've never suffered from depression in my life. Never, nothing. I'm just upbeat. Nothing ever got me down. Look on the bright side. But in the past year, I really had depression. I had depression to the point where I went to a doctor. I just couldn't control my woe. It's me. And I just didn't feel right in my head. And it just it took away some motivation. It's hard to explain. And I don't know. My doctor said, she said it wasn't clinical depression. She said I had situational depression. And I said, I don't know if I agree with you. I think as long as I have this problem, I'm going to be depressed. I said, it's not just because it's limiting me. There's something else physical going on that's causing this. And I've never had this before. And so she prescribed medication, of which I never took. But instead, I said, I'm going to beat it. I'm going to solve this problem. And sure enough, I have a completely different outlook. I have the outlook I used to have. My husband has his wife back, and everything's, it's just like the cloud is gone. And I've got all kinds of aspirations and things I want to do and animals I want to transport, and can't
That's
wait to
fantastic.
pass my medical to fly again.
Quick question, just stepping back. Did you do a provocative test?
I did not.
You did not. Okay, so it was Dr. Kofidis was able to deal with everything off of the CT scan.
No, yeah, the angiogram, yes. Well,
Oh,
it
the
was
angiogram
very
and the
obvious.
CT?
Yeah, I had
Okay.
multiple CTs and I had the angiogram, but it was very obvious. And that he said, I can identify, I know exactly where it is. He said, the problem is you have two complete twists. And that's rare. And, and he even said after surgery, he said, when he opened it up, he also did, he cut along the heart all the way up because of the possibility of endothelial dysfunction. So I don't have that. I'm not having to heal from endothelial dysfunction for the next 2 years. But he said as soon as he took that LAD out, he said it plumped right up like a perfect LAD, and he set it on top. And he said, but I do need to let you know that if down the road at any time you do have that sharp pain back, and because I've talked to him since, if that angina comes back, if something happens, you need to call 911 right away. Because since my since my LAD was so twisted, kind of like a hose, when it's twisted forever, it kind of wants to go back to that kinking position. He said, I don't think that's going to happen. I just want you to be aware. Don't take your pain lightly. You're not supposed to have heart pain. So if you have heart pain, you go in immediately. I'm like, okay, but I'm not
And
going to have heart pain.
yeah, right, there you go. I'm going to think it away. It's not
Nope,
going to happen.
nope, it's not going to happen.
We have a lot of people who are doing what you did with the podcast. They're listening to the episodes, hearing what people are saying. What would you say to somebody who's suffering the consequences and they're just paralyzed to get anything done about it?
Oh my gosh.
Fear
Uh,
and
oh, that just
uncertainty
gave me
and
that you saying that I have chills. I mean, it's like PTSD. Like I remember so well that feeling that they feel, and just feeling like nobody understood because it's such a condition that people aren't familiar with. Your doctors don't understand. Your spouse might not understand. Your family might not understand. It took a lot of convincing for my family. They were not supportive at all initially. What I can say is you've lived with your body since birth. You know what is right and what is wrong. You know that if this doesn't feel right, it's not in your head, it's in your heart, and it's real. And there's so many of us that have gone through the exact same thing. And there's hope. There's hope now. And there's hope because of the podcast, because of the Facebook group, because of the support that is out there. And if I could say anything, do what I did. Just listen to the podcasts. If there's a few podcasts that ring true to you, listen to those over and over. Those podcasts gave me support. And there were a few posts on the Facebook once I joined Facebook that I actually screenshotted. And I think I told you I had created a binder of all the surgeons. And when I was making my decision on what surgeon to go with or who I wanted to interview with. And in there, I also had screenshots of the Facebook where I felt support from that. And they weren't to me. These weren't messages to me. They were messages to each other. So I'd say fill your head with positivity. Just stay positive and don't let the negativity get you down, and continue your fight to do what's right for you and for your body. And whether it's you're going to go through insurance and be here in the United States, or go to Dr. Kofidis or another doctor, you will know when you found the right doctor, and you will know when you found the right path, and when the timing is right. The timing has to be right. The timing for me was not right 3 years ago, 4 years ago. It wasn't right when I first came home from Colorado and went into the hospital. It wasn't right then. The pain of living with it has to be greater than the pain of going through the surgery. And when you're at that point, then you take that step forward and you go through the surgery and you endure the tubes, you endure the back pain, you endure all that recovery. And hopefully you have some of the nurses like I had over at Greece that would sneak me a Diet Coke and rub my feet and come in and tell me stories about their kids. It was amazing. It was really an amazing experience. But I just, I can just say you've got the support here and take advantage of it.
I don't think you could have said that any better. The pain, when the pain of living with it exceeds the pain of the surgery and the process, it's time to get it done.
Yep.
And that is it's just a wonderful statement. Mary, I can't thank you enough for your time and your conversation. I really appreciate it. I love the positivity. I absolutely love positivity. You're just simply awesome. And a pilot,
Oh, thank you.
make sure you get that license renewed before I, hear about any more flying. And
Yeah, well, my flight doctor declined me and failed me because of my accident, pain with my wrists, and because of this. I told him what happened. And so he's like, "You're not getting a physical today because I'm not going to mark down that you failed, but I'm just telling you, if you are coming in for a physical, you're failing. So you need to get this taken care of." So he knows I had surgery, and I'm waiting another 3 months, and then I'm going to go back in and hopefully I'll pass, which I think I will.
oh, I'm sure you will, and I can't wait to hear it.
Mhm.
Your attitude, your positivity, they really play heavily on both your decision to make the decision to go and also your recovery. And I'm so glad that you're able to do what you've been doing. You're getting back on track, and I can't wait to hear the story of your next solo flight. So, you know,
Thank you.
from
And my marathon, I'm doing a marathon next June in San Diego.
oh, you'll have to reach out to Sarah Miller, one of our early episodes. Sarah and
Yes.
Veronica both were marathon runners.
Yes, I know. I listened to their podcast multiple times.
Well, from the very bottom of my imperfect heart, thank you so much.
You're welcome. Thank you. Thank you for all the support and the encouragement, which helped me to get to where I am today.
Thank you for listening to Imperfect Heart. It's my hope that this information helped in some way to improve your situation or will help you better understand this condition. More importantly, that it gives you hope through stories that there is help and you most certainly are not alone. If you've been diagnosed with a myocardial bridge, please be sure to join the private Facebook group, Myocardial Bridge Support Group. For more information about our program or to reach me directly, visit the website, myimperfectheart.com. If you like what you heard today, please give a positive review, thumbs up, high five, or whatever your app likes. And be sure to share with everyone important to you so they understand what it is you're dealing with. Please subscribe as well. Welcome each day with gratitude and positivity. The views and opinions expressed in this program are solely those of the host and the guest and are not intended to provide, nor are they a suitable substitute for, professional care by a doctor, therapist, mental health professional, or other qualified medical professional. Imperfect Heart is a production of Hear Me Now Studio.